All right, everybody, we're about to get started with today's topic, external focus of attention and how to apply that to your patients or your clients with the motion guidance system. So we're going to wait one more minute and let people log on, and then we're going to get it started. All right, guys, let's get going. Thanks for joining me today. This is Eric with Motion Guidance again. Today's topic is external focus of attention and how to apply that with the motion guidance system. We're going to go over some research about external focus of attention, how it was kind of initiated a few years ago with some research by Gabby Wolf and some others, and then look at some examples on video that I had on our database that are also available on the YouTube channel to take a look at, and we'll describe it using the kit. So if we want to talk about external focus of attention, we definitely want to determine kind of what the boundaries of external focus are and mix those today with some other things that have been published that include autonomy of support and enhanced expectations. While we are using the clinician kit to apply these concepts, the easiest low-hanging fruit that you can use is the laser as your external focus of attention. So as we try to get the focus away from an internal focus of attention or cueing into an external one, so things that are outside the body, the laser automatically provides that for your clients and for your patients. So I'm going to switch screens and share a little presentation with you, and I'll walk you through that. Some of this information is taken from our online education modules that are available on the website, so you can check those out. So let me switch over here, and all right, so let's share my screen here. All right, now we can come over and we'll play this guy. So as we go through internal versus external focus of attention, you'll see, oh my goodness, kind of mute that there. So a person might go through a number of internal and external thoughts during preparation for a particular skill activity. But the current strongest research suggests that an external focus during movement will produce the most skilled results and the best retention. So we'll go over that next. But an easy example of these things is seen in golf regularly, where the internal focus on what are my hands doing, what is my body doing in order to control my swing, can produce faulty outputs of motor control and lead to very simple tasks being performed inappropriately. And of course, we add in environmental stress and other factors like maybe wind in this case, or even fatigue, and those can become enhanced. And you can lead to what's called in golf as the yips. And so in 2017, Gabby Wolf and some others did some research that involved motivation and performance and enhanced expectations, autonomy of support, and then looking at the external focus of attention piece. And as we go through this research, the main focus there was understanding that the focus of the goal, what the focus of the goal of the task is. And so they published this in 2017. They called it the triple play, using enhanced expectations, autonomy of support, and external focus of attention. So if we break those down individually, enhanced expectations is essentially creating an environment of success utilizing knowledge of performance and knowledge of results, which is augmented feedback, during novice skill acquisition. So having people succeed early on is critical as far as the elements that can contribute to retention and what we deem to be learning for a particular individual. As we go along the motor learning path and we get into higher levels of learning for people who are more experts in the field of what they do with motor performance, this is required less and less. In fact, they learn more from the opposite. They learn more from the failures that they're getting than the successes, although they can mix and match those throughout a spectrum. The second component being autonomy of support. So having an active choice of participation from the task performer. They have a say in the performance of the task. So what we are doing today, I want you to have a choice in how you think that it might be best for you to perform today when you're learning a novice skill. And then you have external focus of attention. So the attention is placed outside the body during performance. So if we break that down into an algorithm form, optimizing performance through intrinsic motivation and attention for learning, we have the motivational pieces. So that autonomy of support and that enhanced expectations can dictate the motivation for performing a particular task. Now, this is going to be very important, especially for the novice skill performer, that they are motivated to perform certain things. So of course, dangling the carrot, giving a piece of candy metaphorically to a person can be very instrumental in getting early successes, and then having them reflect on that success later, which will enhance their learning through reflexive feedback and breaking down things even subconsciously that we see in other portions of the literature for performing those tasks. And if we combine those with the external focus of attention for the focus on the task goal, that'll lead to increased motor performance, and that should yield higher motor learning or retention is what we see as that. And so we see it as the optimal learning model, but that is an outline for optimizing performance through intrinsic motivation and attention for learning. So here was some of the publications in this particular article. Now, the task for this, they took deflated tennis balls and they had people throw it at a target that was a bullseye target. And the center bullseye was 100 points if they hit that from a certain distance. And then the rings kept moving outward from there, and people would get points. Less points, the more off the bullseye they were. And so they structured it to have two different types of feedback, either autonomy of support and enhanced expectations, or autonomy of support and external focus. But as they went through the block trials of performing these things, you can see the pre-test, post-test numbers, including the standard deviation. If we combine the autonomy of support, the external focus of attention, and the enhanced expectations, those performers had yielded higher retention, or what we would determine to be learning or improved performance. Also, on the retention tests or the post test there. And so if we break these down individually for enhanced expectations, if we visualize an archery target, this archery targets, everything on this target is suggestive visually that there's going to be an improved performance as you get toward the yellow and a worse performance as you get toward the blue. Well, if you tell your learner that this archery target is all a success, you're not going to break these down based on points, but if you just hit the target, or if you stick the arrow into the target, that would acquire a positive reinforcement for them versus trying to focus centrally on the bullseye. And so we'll go over a little example of this later in another video that I have. But this will really kind of change the game and what the expectation is on performing the skill, trying to promote a very positive response to that versus maybe a daunting one by your novice learner. If we get a little bit into autonomy of support, there tends to be hey, if I want to instruct a person in how to do something and I don't give them a say or a determination or a choice in what they can do, that might yield a negative thought process or a negative results in their acquiring of the new motor skill. So oftentimes we dictate things by either having a successful path or a failure path, and we want to change that and say, well, if there are multiple ways that people can get this done, they can possibly choose the door, as you see the little diagram in the bottom right, and there might be a better or best one for them eventually to improve their performance and improve their retention, but none of them might be bad. And so giving them a way of just acquiring these skills early on versus trying to correct them in what we think would be the best might not be in their best interest early on as they're learning. And then, of course, the external focus of attention. So in this picture here, she's going to shoot long with that ball going into the bucket. And then she is going to be focused on how it left her hands, how she was gripping, where her arm was swinging, instead of just trying to focus on the bucket and make a determination of where the components are that she can throw into the bucket for success, and be less focused on the things that are going inside of her body. Okay. And so if we think about how we're communicating with our patients, a lot of patients are visual-based learners with how they're acquiring these skills. Yet in our populations as professionals, we tend to do a lot of hands-on things, a lot of kinesthetic feedback approaches, and a lot of words. And so I'd like to challenge you as clinicians to go back and see if during your clinical applications of skills or exercises for your patients, that you tend to be a little bit more visual from now on, and then add in different components of auditory and kinesthetic instead of being dominant with your feedback by auditory and kinesthetic, and then start to add in external focuses of attention, enhanced expectations, and autonomy of support, if possible, early on, to really drive home their preferred learning style and then their retention of these skills. And so getting away from that is pretty relevant in the literature. Too many instructions or explicit feedback might actually yield decreased performance. So trying to just give them simple tasks or instructions early on can really benefit them in acquiring these skills. And then you can add more explicit feedback later as they're going through these particular skills. So essentially, if we replace an internal focus of attention with an external focus and possibly utilize that knowledge of performance and knowledge of results a little more judiciously in how we give those back to the patient, then our external focus should yield automaticity and efficiency of movement versus unnecessary movement patterns and discoordination with our muscular activity versus an internal focus. All right, so if we get rid of this and I bring up some video examples here, and so if we look at, make sure this is muted here. If we look at this quadruped exercise, so this is a very common exercise that we utilize for back pain or possibly instability or just body awareness, maybe even for upper extremity or lower extremity loading, SI dysfunction or pain, things like that. These are just very common. And so if we add in the visual component of motion guidance to these activities, but then we utilize enhanced expectations and autonomy of support, we typically see what we would see in the literature of an easier retention long-term and what the person's trying to do, especially for home, as well as increased performance in the clinic. So if we go over this as an example, and I'll see if I can get everything out of the way. So we have a target underneath her that's bullseyed, and that laser is across her waist and it's bullseyed down there on the target. And so she's ready to be able to move. So you could do a pelvic tilt in this particular case if you wanted to, or you can start going into limb movements. So she's going out into limb movements. I am not going to give her any instruction. I'm just going to ask her to lift an arm or lift a leg behind her, and we're going to let the patient just figure out what to do in this scenario. So if they ask you questions about, hey, do you want me to keep the laser focused on the target? I often defer to say, no, I just want you to move and let's see what happens. They automatically gain a form of competitive nature with this in trying to center up the laser. And if they can't, they'll see it right away. And so in order to let them discover what's going on, we want to pull back oftentimes our verbal feedback and let them discover or explore the strategies to get this done. Now, in order to tie into enhanced expectations, I can turn the target over and tell them, well, let's just say anywhere on this target is acceptable for keeping the laser. So as they move, the understanding of the goal of the task is the same, but it's broadened instead of centered down into a bullseye target. So once they understand how to move and what they're going to do to the task, then you can put them back on the bullseye and maybe challenge them to keep the laser inside the yellow in this case, or not have it go out to the outer blue or the clock area as they're doing the bird dog task. Now, once they can do that, maybe you enhance this by challenging them to independently disassociate movement through their arms or through their legs. You can even have them maybe move their torso. And the cueing there would be, I want you to keep the laser still. That's your external focus of attention. Or I want you to move the laser maybe off the target. That would still be an external focus of attention. It's driving the body to understand how to coordinate to perform that task, but the word instruction is much different, okay? So once again, this focus here would be keep the laser as centered as possible as we're doing a reach under and touch from the hand and the knee. But my instructions are not trying to brace your trunk. My instructions are not keep your trunk still. My instructions are not trying to keep this object balanced on your back or something that draws more attention to their body. My instructions are going to be more of an external focus of attention and be focused on the laser underneath them as they're moving. And so if I want them to attempt to move that laser in one direction or the other, that's my cue. It's not, I want you to rotate your torso to the left. I'm going to tell them, I want you to rotate the laser to the left or rotate the laser to the right, okay? Now, this can be very advantageous if I stop this video and let's get rid of that one. Let's go on to the next video. If we take a look at this person here in this same type of setup, this was a person on one of our classes pre-COVID that was going through the instruction portion of this, the lab portion, and she had chronic low back pain for more than 10 years. And so if we watch what's happening with this video, and I'll make sure this is down too with audio. So I had her assume a comfortable position in hands and knees. Then we projected the laser down with her to the target, and automatically I turned the target over for enhanced expectations. And I cue her to try to move the laser above the target, and she struggled there for a second to move the laser up. Now, when I cue her to try to move the laser down, she moves the laser up again on the target. She gets confused about how to do that. But I didn't give her extra cues. I just said, try to move the laser down, and I let her take some time. So I'm shaking my head there a little bit, okay? But she's trying to figure it out, and she's laughing because she doesn't know how to do it, and then she figures it out. So giving too many explicit cues or too many knowledge pieces about what we want them to do can often lead to poor performance and confusion, okay? And so at the end of my video here, I'm saying, instead of saying, hey, don't move here and only move here, giving them tactile cueing and more auditory cues, allow them to be highly visual with these tasks and figure this out on their own, should lead to tying into enhanced expectations and autonomy of support and external focus of attention, all combined to get the most learning and retention out of your patient as they go through these skills. And then once you start out with some basics, you might want to go on to even more dynamic activities here. So if we put the motion guidance laser on my knee here, and again, these are on our YouTube video if you want to go and access those. but showing, let's see if I can kind of scroll through here, get rid of this. Nope, it's going to stay there. So as I want to cue a certain move with my right knee here as I swing the golf club down and through, that laser is going to come close to my left knee. I can standardize this by directing the laser before I get the setup for my golf swing, and then I get immediate visual feedback as an external focus of attention of the laser ending up in a certain location on the floor, and that tells me if I've had adequate leg drive over here on the right side. I don't need to get information from my body as much as reproducing where I am with the laser each time I go to swing. So as I accelerate this, you can see that laser ending up in the same area each time, okay? And then I can get more feedback from that and combine that with other skills. Once I learn this, then I can start focusing on other areas through my follow through if I wanted to, where my my torso or my head is focused on, and start doing multiple pieces of a particular skill and breaking those down to learn what I'm doing with each individualized skill. All right, so if we come up here and stop sharing my screen, all right. And so, ultimately, we want to try to tie in our motion guidance kit into the external focus of attention pieces, the autonomy of support, and the enhanced expectations to build our novice skill acquisition to drive improvement and get more carryover into the home exercise program components of what our patients are doing. All right. All right. If you have any questions right now, you can dive into the chat room and ask those. Otherwise, I'll move on to giving you guys the discount code for this week by being on the live stream and going over the external focus of attention and how to utilize that with the motion guidance system. So I'll just wait a minute if anybody has any questions before I get to that. Well, thank you for Jerry very much for joining me today on the topic of external focus of attention and utilizing that during the implementation of the motion guidance kit. And we'll see you in 2 weeks as I discuss home patient packs and how to drive revenue through your clinic. Have a great rest of your day, guys.